Alright, in this video we're going to go over how to create a telephone call from the template. So let's get right into it. So first of all, you're going to want to select your patient. So remember, go up here to the select patient tool and we'll pick a fake patient for today. And let's do this one here. Okay. So when you open it up, you'll be familiar with the baseline bar here that gives you some basic information, and then your patient history window here. The first thing you want to do is make sure you've created a new folder for today. If there's one already created, you can use that one, but you want to create a new one if there isn't. So today's December 3rd, so we're going to see that here. And next thing you want to do is you can either click this here to get a phone call, but the fastest thing to do is actually to go up to your bar here and click telephone call. And it's going to automatically get this ready for you here. And so you don't really need to select a specialty or a visit type for this because this is not an actual visit, this is a phone call. So here's your different choices for communication. There's medication management, medical question, test result request, referral request, forms and records, lab and radiology, other, outgoing call, and charges. I'm going to review some basic ones today. We won't go through all of these. The most common ones that we use would be medication management, medical question, other, outgoing call. So we'll go through those, and then you can use the other ones if you see fit. They're all fairly similar. So let's go through medical question first. This is your basic telephone call from a patient who has a question for the provider. So you'll see first that there's a few different fields you can fill in. You can fill in as many or as few as you like to get the information to the provider. You'll want to at least probably click a contact type, and it's going to be an incoming call. If you get an email from the patient on the portal, you can click incoming email. So we'll go ahead and select incoming call. Urgency, you want to give the provider a little bit of an idea of when this call needs to be returned by. So we'll say, let's say just by the end of the workday. The name of the person you spoke with, you can either select the patient or you can select another person name and relationship. So let's say you spoke with the patient. The date and time of call will automatically generate based on the time you initiate this template. If it was from before this, you can actually click that and change the time. If you want to, you can fill out the concern and duration of symptoms, although you don't have to. And then you can just click in here and type a comment. If you'd like to use a my phrase, you can do that, and you can learn how to do the my phrases based on the prior video I showed. Then when you're done with that, you'll select a priority. Now if this is an urgent call that you want to get the provider's attention for, you need to select this box by single clicking and then change it to a high priority, and then you'll click send and close. Now when you click send and close, you'll get a list of options. You can open up the provider's boxes here to select the provider and then move it over to the side. You can see your priority's been listed here. You can change it here again if you like, high, normal, or low. You'll see this icon on the inbox, which I'll show you, and then you'll select your provider. Now, if you don't select anybody, it's going to go to your own inbox, so make sure you've selected a provider for this to go to. You can click OK. It'll give you a message that says it's going to go to my own list here because I want to show you what it looks like. Click yes, and you're done. Now, since this went to me, I put it opened my inbox here to show you what it looks like. So this comes across with the due date. The exclamation point means high priority. This is the patient name. It's a medical question phone call, and then this is a description. So if you now on the receiving end, right click, open the patient's template. It'll go right to the phone call, and you can write a response here. So that's the basics of the medical question template. Now, medication management. This is really useful for refill requests. So what you want to do is you want to, again, click the contact type. Let's say it's an incoming fax. You'll say whether you spoke with anybody. The urgency will be, again, whenever they think they need to be returned. You'll select the patient's pharmacy, so you'll have options up here. and let's say they want it to go to Walmart. The patient request notification when complete, you can do this and give a phone call or an email or however they want to be called back, and it'll put in their phone number. If they don't need to be called back, you don't have to select this box. Okay, then what you want to do is you'll want to go down here and click the medications they want refilled. So just you'll select the side here, click the medication. Let's say they need Nexium, and then you'll go ahead and mark any comments to the side here. Let's say needs 90 days. Okay. You'll click the priority. We'll leave it normal this time, and then we'll send and close. And again, I'm going to leave it blank so you can see it come to my inbox. Okay. So we'll go back in here. Again, this one's not a high priority, so you don't see it with an exclamation point. It'll say the patient's name, medical management, and again, it's different now, so it's medication management. You can open the patient's template. As a provider, go right to this. You can go ahead and double click on the field here for medications, and you'll be able to go right into the medication list and refill their Nexium for them. And you can go back out and note that you've approved it and you've e-prescribed it, save it and close it, and then eliminate it from your inbox. Okay? So that's medication management. The last one I'll show you is in other. And this is very similar to prior ones, although this is for really anything that you need to do. Go through your fields here and identify what you need to there. Click on what phone number you want to use, and then just comments in here. Okay. A few quick things I want to show you, some useful buttons. You can click on this to see their medication list, allergies, and their problem list, so you can kind of review that. The other thing you can do is click on their appointment list and kind of see when their upcoming appointments are due. Since this is a fake patient, they don't have any upcoming appointments. And then you can go through the telephone call summary, and this will list all the phone calls previously in order by date. And so if you wanted to look at the phone call that was from yesterday to kind of remind yourself of anything, you can do that there as well. Okay, and then when you're done, you can just click out and move on to the next thing. So again, if you have any questions, please comment below. The more you use the templates for telephone call, the better you'll get at it. And remember, click up here to use the fastest, or to get to the telephone call the fastest. So let me know if you have any questions. Thanks.